Yeah, hello everyone. I welcome each of you to my YouTube channel. Yeah, in our last video, we looked at acute coronary syndrome, and one of the differentials that we talked about was pericarditis. So today we are going to look at presentation of pericarditis, essentials of diagnosis, the differential diagnosis, and the treatment. In the previous video, we looked at the acute coronary syndrome. We looked at its essentials of diagnosis, and we also looked at the differentials plus also the treatment. So, acute pericarditis, from the word acute, it's of immediate onset, and it refers to the inflammation of the what? Of the pericardium. And this can be due to a viral infection, it can be due to drugs, it can be due to recurrent myocardial infarction because of the reduced perfusion to the pericardium. Then it can also be due to autoimmune syndromes, renal failure. It can be due to cardiac surgery, trauma, or neoplasms. Then common symptoms include pleuritic chest pain radiating to the shoulder, that is to the trapezius ridge, and dyspnea, that is difficulty in breathing. Pain improves with sitting up and expiration. So when you get a patient, they feel much pain when lying, but on sitting up and on expiration, they feel there is that pain relief, chest pain relief. So you can have pericarditis as a differential. Examination may reveal fever, tachycardia, and an intermittent friction rub. Cardiac tamponade may occur in any patient. So the intermittent friction rub comes as a result of remember that we're having inflammation of the pericardium. So when the pericardium gets inflamed, there is that reduction in the pericardial cavity is going to reduce. Therefore, there is that contact between the two surfaces, giving us this intermittent friction rub, which you can notice on auscultation. Then electrocardiography usually shows the PR depression, diffuse concave ST segment elevation, followed by T wave inversions. No reciprocal changes are seen. Then on echocardiography, it may reveal pericardial effusion. Since this pericarditis, normally it can be as a result of infection. Yeah, you can have as a result of infection. It might present with a fever, or it may also present with what? With this pericardial effusion. Then some of the differential diagnoses you have is acute myocardial infarction. It's a differential. Acute myocardial infarction would be our differential. Then aortic dissection, that is that is rupture of the aortic walls. Then we have pulmonary embolism, call it a PE. That is dislodgement of a clot into the pulmonary vessels. Then pneumothorax, that is air within the chest cavity. It can be as a result of the perforation of the lung parenchyma. Then we have pneumonia, then cholecystitis and pancreatitis. Pancreatitis, inflammation of the pancreas. It can be as a result of blockage of the blockage within the pancreatic duct, therefore bring about pathology within the pancreas. Then treatment we are going to use aspirin or non-steroid anti-inflammatory agents such as ibuprofen or indomethacin. These will help to relieve the symptoms. Colchicine has been shown to reduce recurrency, rarely steroids for recurrent cases. So rarely, at times you can use You can use steroids like prednisolone for the recurrent cases, prednisolone, hydrocortisone. Then hospitalization for the patients with symptoms suggestive of significant effusion, cardiac tamponade, elevated biomarkers, or recent trauma or surgery. So you normally hospitalize them for monitoring. Get it? Then patients with pericarditis often present with chest pain that is worse when lying flat. So always a patient, they will come to you and they will have this increased chest pain, that is all aggravated chest pain on lying and relieved on what? On sitting, on sitting up. So that will be your number one differential to come to your mind as you take the history, as you try to explore the pain and you ask the patient. They'll always tell you the pain on you asking for the aggravating factors and the relieving factors. They'll tell you the pain is aggravated on lying flat and it is relieved on sitting up and expiration. So that will give you a clear marked differential of acute what? Acute pericarditis. Thanks for listening. Let us catch up in the next video. Subscribe, like, comment. All the best.